to manage acute low back pain. There's a lot of different ways that people do it. And they all have their merit. They all have their, for lack of better terms, their traction in managing these patients. And we're going to look to see what place each of those can play, where they fit. And for us, it's as much about a process as a technique, all right? And some of the things that you guys have mentioned, we're going to go back to and use. Reduction and centralization and directional preference. There's not a better metric in the literature for return to work with acute low back pain than directional preference and centralization. Those have been shown over and over again. Like you said, though, the problem is, it's not a problem. The challenge that we face is not everybody responds. Those models are built on populations, not on people. Does that make sense? And so I had my background there. I used it a lot, and I had the same experience. I'm not here to disparage it. If people have centralization, that tells me a lot about the state of the disc, really. In fact, you know, it's kind of funny too, this is the McKinsey group. They teach that the tissue is not the issue, and yet their researchers, Donaldson et al. And colleagues, they found that those people that centralize on MRI had an intact outer annulus. That's the tissue. So the tissue actually is an issue, and it can tell us a lot about the health of the disc when people centralize. So we'll bring that into discussion and roll it in, and perhaps we can begin to see how that behavior shapes some decisions we make, all right? We just may not put everyone on press-ups, but we might put some people on them if they respond well to it. That it still has its merit, but I think rather than saying we're going to do this instead of this, we want to broaden the fishnet that we cast. You see, and try and help more people and encourage them not only along the trail of recovery, not only to try and promote their recovery, accelerate their recovery, but also help them to prevent recurrence. So.